That's fine.
So I'll start the recording now, and then we're going to double stream it to YouTube. Something. I'll work on the double stream. Thank you for taking time out of your day, Erika, to come be with us. I am Matthew Gillick, and this is, of course, our wonderful co-host, Aishu. And this is our 7th episode of Rain Talks. So really excited to have you here today, really excited to get into some of the topics that we have lined up and hear about your background and some of the adaptations you're making during these times.
Yeah, thanks so much for having me. I really appreciate it. So as you can see here, this is who I work for, and I do want to say before I get started that everything that I'm saying here, these are my personal opinions and don't reflect my employer. And this should not be mistaken for any sort of medical advice. If you have any injuries, you should be speaking to a provider about them. So with that said, I do work for MedStar Health. I'm contracted to Dr. Henry A. Wise High School in Prince George's County, where I provide sports medicine services for them, for the 400 to 500 student athletes there. And part of my job, I am also spending time with a sports medicine physician, which is an awesome part of my job. I get to see some of the kids in the office in a more formal setting, and it really helps kind of close the loop on their medical care. As far as my background, I have a bachelor's degree in athletic training from Cedarville University in Ohio, and I have a master's in kinesiology and sports medicine from University of Virginia. I've worked at MedStar since 2016, where I've been in a variety of roles there. In the past, I've worked in Division I, Division III college sports. I did help out with the DC United Youth Development Academy for a while with MedStar, and now I'm contracted to a high school. So it's definitely been an interesting ride with my career to see, all the different aspects of sports medicine and how injuries can manifest on different levels. And I'm happy to talk to you all about that.
Fantastic. So how has the transition between all those different levels been, going from working with athletes at the academy to working with high school athletes? How is the transition between levels?
Yeah. Oh yeah. I mean, the biggest difference in different sporting levels, I would say, is time and resources. So the time that I have with each individual athlete and the resources that I have. So resources can look like, athletic equipment in the athletic training room. It can also look like having a strength coach, having mental health care on site. When I worked at the University of Virginia, I had a small team of about 15 people that was my only clinical responsibility. So I obviously was able to give them a little bit more one-on-one attention. Whereas when I take care of 400 to 500 student athletes at the high school, I really rely heavily on other professionals such as physical therapists, team doctors, their coaches that have strength training backgrounds. So I also really rely on home exercise programs and just education, which is probably the most fun part of my job, is just getting people to understand their bodies.
Yeah.
So it's a pretty big difference. I pride myself in being very flexible with all the different types of athletes that I can work with. So it's never a dull moment.
Yeah, so you talked a little bit about home exercises. So kind of transitioning to right now where everyone is stuck at home, how should an athlete make sure that they can prevent these types of common injuries that they have when not being able to train at the same level that they were training at pre-COVID-19?
Yeah. So I think the biggest thing with returning to training after this whole quarantine situation, I think, is managing your expectations. And you shouldn't, I mean, as much as I hate to say it, you shouldn't expect to go directly back to the level that you were at if you haven't been training at that level all along. So we've not all been, on the pitch with our teammates practicing and having that contact. So our bodies are actually quite deconditioned from the activities that we were used to. So I think understanding that it's going to be frustrating, but to understand that it's going to be different when you return to your sport. That said, you should be realistic with yourself. Most of your opponents are in the same situation. So you shouldn't be negative towards yourself and your teammates. You should be gracious and understand that it's going to be a journey and we're all in this together. I think one of the biggest things is just stopping if you're in any discomfort or pain when you're doing something. Just the deconditioning your bodies have gone through. You'll have more overuse injuries. Things that didn't hurt you before will probably hurt now. It's also smart just to take care of your body and make sure that you're hydrating well. And if you're looking for a way to stay fit right now, I would say mimic those things that you want to be doing on the field. So if you want to keep your cardio endurance high, make sure you're running a lot during this quarantine time. If you have people at home that you can work on foot skills with, you can work on that and keep getting a little contact with the people you're quarantining with. So you'll have to be creative, but I think that there is a way for you to still maintain some fitness during this time.
Yeah, I think one of the points that you made, where everyone's on a level playing field. No one has a fantastic home gym at their house that you don't have, right? So it does level the playing field. And we actually signed an agreement with DMV United that says, and I think it's like 150 clubs in the area that are like, we're not going to take advantage of this by, doing some shady things in transfers and stuff like that. But I think that's a really good point for players to keep in mind.
Yeah, it's definitely frustrating. It's almost like you're coming back from an injury. Like if you haven't been able to maintain, then you are going to see some differences. So I wouldn't be too frustrated about it.
Still working on the YouTube stream. Sorry. Aishu, do you have the next question for us?
Yeah, sure. This is kind of like tagging on with that mentality and making sure that you can make sure that you're keeping up with what you need. What issues should young athletes, student athletes, soccer players specifically, because we are a soccer team, be most aware of in terms of injury prevention?
Yeah, I think one of the biggest things that is definitely underrated is a good long warm-up. That's super important. And in soccer, we have the FIFA 11 that the FIFA Medical Research Committee put out several years ago that has a lot of significant data behind it, that they've done research on it, and it shows that people will have a decrease in injuries when they do this warm-up. So it's all online. I sent you guys, or in our document, I put the YouTube, it's actually like a playlist on YouTube of all the FIFA 11 moves with some pointers, for how to do them properly and do them with good mechanics. And so I think doing an important warm-up that cannot be overstated. It's so important. It sets you up for a good practice. It sets the tone for your practice. Another thing that you should be doing is a good cool down. I know when I exercise, I'm done working out, the last thing I want to do is spend time on the foam roller or stretching. I just want to go eat. I want to sit down, just goof off. But it is really important that while your muscles are so much filled with blood, that it's important for you to take advantage of that flexibility of muscles. And that's also very important. So I would say if you weren't doing those things before, it's a really good time to start doing that.
There's no time like the present.
Yeah, exactly.
Yeah. I think that especially young players, I think that's one thing that they forget. They're jumping straight like, okay, I did this thing now I'm going to go do the next thing without cooling down. And I think that can inhibit some of the muscle development as well.
Did you manage to get the YouTube up?
No, I did not. So I'm going to stop trying and focus my efforts elsewhere. So we talked a little bit about the transition between the different levels, but how is your approach in a one-on-one setting with an athlete that's been injured, say a high school athlete versus a D1 athlete? Is there a difference in approach to the injury? Is there a difference in approach to the mentality that the injured player has?
I mean, a lot of high school athletes, this is the first time they've ever had a major injury. So there's I think a lot more education that goes into that. Mm-hmm. Now, that's not to say that certain college athletes have been fortunate enough to not get injured until college. So, they might be going through some of similar struggles, but it's important to take into account their history, with understanding injuries and just making sure that they understand everything that's going on. And I really think the mental piece of injury recovery is super important. So just kind of letting them know what to expect after an injury. I think, the younger the student athlete, the obviously less life experience they have. So I would usually really hit home the educational pieces. As far as the care they're getting, it's not all that different. But in the high school, I have less time because I have more athletes. So a lot of the time, the high school athletes are getting sent out to PT or seeing strength coaches on their own, just because I don't have the time and resources. I have very limited resources as far as like exercise tools and stuff in the high school, and just don't have the time to use them. So the kids are going out elsewhere. So a lot of that, it's really important to communicate with the other professionals that they are working with. But yeah, I think the communication piece is pretty big too, like between the parent and the other professionals.
Right.
Yeah.
Yeah. How far beyond the injury would your services go? So like, you said the high school athletes typically have kind of a network of doctors that they go to. I think it's a little bit easier when they're in high school because they still have that network, but college athletes that's traveled across the country may not have that network. How much do you spend on the mental after injury?
Oh, wow. I mean, athletic trainers are pretty much responsible from the moment the injury happens until they step back on the field. So we're kind of with them in the journey the entire way. And even, past returning to the field, it can be really frustrating to not be at your previous level. So I think athletic trainers are really good at being with their athletes along the entire route of the injury. So I mean, there are athletes I've worked through injuries with that I still keep in touch with from 5 years ago, from 10 years ago. So you really form like a strong bond with them over that. And it's really nice for them to know that somebody is there who understands. Yeah, I would say that the relationship and the work on the mental piece goes well beyond the return to the field.
That's a great point.
Mm-hmm.
Yeah, in terms of like resources and your experience between being an athletic trainer at a D1 school versus like a high school or the DC United Academy, I know a lot of our players are wanting to be at that level, that college level, after they're done with their high school education. What are the biggest like differences, indicators that from your experience show like a college athlete versus a high school athlete?
I think willingness to take instruction and to listen to the people around them. I think attitude is a big thing. So having that mindset of, I don't know it all. I need to listen to the people who are around me. And also understanding that part of taking care of themselves and that their actions during the day have repercussions on their athletic performance. So you can't just sit around and eat gummy worms all day and come to practice and you're going to feel awful. But I find that the kids who, you know, find a way to make that a priority will move on and do well. So I think listening to your coaches is a big one, and just that coachable spirit. From my point of view, I think that's one of the biggest things, that attitude and the ability to listen. Yeah, I think that that's really key.
Kind of the tack onto that, how important is diet towards injury prevention and performing at that high level?
Yeah, it's so important. Just you can't expect to perform well if you're not fueling your body. It's like putting something other than oil in a car, or, you know, trying to use fuel that's not what your body needs to run. Another really big part of diet is the refueling after exercise. So you can't expect to go home and eat candy and feel awesome after a really hard workout. You need that high quality protein. You have to refuel. Because anytime you're doing exercise, you're actually breaking the muscle fibers down at a microscopic level. And if you're not giving your body the building blocks it needs to rebuild after that, it's really all in vain. So yeah, definitely a good diet, high quality protein is super important.
So no more McDonald's after a match, right?
I guess it depends what you're getting. If you're eating the burger patties, that might be okay. But yeah, I probably wouldn't do like a huge milkshake. Yeah. Although you do need to, you know, replace the calories that you use. So I can't say you can never have a milkshake, but maybe just rethink a little bit.
Yeah. Connected to that diet piece, let's talk about sleep. How important is sleep to injury?
It's probably just as or more important than the diet. That's when your body does all of its remodeling for the day. So if you're not getting good quality sleep, if you're staying up really late and getting a little amount of sleep, it's not, I mean, there's some research that indicates that increases injury risk. So it's almost like not stretching before. Like, I think it's that important, and there's a lot of research to back it up. So getting the recommended amount of sleep is very important, and we know that younger people need more sleep. So just following the recommendations of your doctor, definitely a good idea.
Yeah, and you also kind of lose that mentality if you're super tired all the time, right?
If you're foggy on the field, you're actually putting yourself at more risk for injuries. You're less aware. I mean, sleep really affects all different parts of your life, all aspects. So it definitely is very, very important.
Yeah, I think
it's one of the biggest performance enhancers that we take for granted.
Yeah.
I think that people just don't realize. It might just be a lack of education, but it really is a big performance enhancer. And I think a lot of problems can be solved just by getting more sleep.
Yeah, that's a great point. And I think that something that people don't realize is that not only are they putting themselves at risk of potential injury, but they're also risking other people's potential injury. Because if I'm going in for a tackle and my mind is back here, I'm going to miss the tackle and take somebody else out and put them at risk. And that all comes down to that sleep part.
Mm-hmm. I think it's something that's not focused on enough in sports.
Yeah.
I think we're learning more about it as time goes on. So that has something to do with it. We're a little bit more aware now than we were even 20 years ago. So they're just always doing more research on it. And it's just so convincing to me.
Yeah. And it's something so basic too.
I know. It's something we all do. You just might not do it well. And, you know, the hygiene around sleep, like not being on your phone right before bed, and just kind of managing like your screen time before bed and noises and light. Like there's a lot of different things that impact people during sleep. And I'm certainly not a sleep specialist, but it makes a big difference.
Yeah. So we talked about diet and we talked about sleep. What are some other factors that would go into a high school age athlete to keep them injury free?
I would definitely say keeping yourself in shape, like continuing to build muscle and working with your coaches to do, the exercises and build the muscle groups that you need to. I think that's really, really important with sports injury prevention. I think another aspect is like the mental recovery of injuries, and just making sure that you're taking care of your mind as well as your body. And I know I mentioned stretching and soft tissue and all of that stuff. I think that's really important, just to overall think about all the aspects of your body and mind, and keep those in shape. I think that's really helpful for injury prevention.
What? Go ahead, Aisha.
Oh, okay. How different do you think injury prevention should look for female athletes versus male athletes? Because I know sometimes, bodies are built different, and female athletes are trained in different ways. So what are the biggest differences, and what should female athletes look out for more?
Well, I mean, females tend to experience a lot of injuries at a higher rate than males. And I know there's so many reasons that people think why that is. At the end of the day, we see that injury rates, like for concussions and ACL tears and that kind of stuff, are higher rates for females. So I think maintaining good hip strength is really important for women. We have wider hips for the most part, and just structurally are built differently than men. So I think maintaining good hip strength is very important. And you can do that like just through a good injury prevention program. You can do that through seeing a physical therapist when you have pains like knee pain. You can talk to a strength coach. I think there's a lot of ways to maintain. It's easy for me to talk about injury prevention for females because I am a female. I think hip strength is important for everybody, but I think just considering the injuries that we see a little bit more often, it is important to kind of tailor that to the issues that you have.
Yeah, that's for sure.
Those were two questions that I had as well. Is the preparation, because in high school females, you do see a lot more ACL tears. How do you, or when do you start preparing for that? At what point in development?
Oh, yeah. I think it's good to start as early as possible. The big thing about ACL tears is a lot of them are non-contact, like a good portion of them are non-contact. So it's not so much that you need to be preparing and teaching tackling, although that is important, but working on good landing mechanisms, because that's usually when it's happening in soccer. You're landing from a jump and you're coming down, you're having some internal rotation of your hip and knee and like a collapse on the inside of your knee, and that's how it's happening. So utilizing that FIFA 11 injury prevention program, that's a really big component, is learning landing mechanisms, which is very, very it's crucial for ACL injury prevention, is just making sure you're landing well, you're running well, and just being mindful of your body positioning when you're landing and doing those tasks. Of course, it's impossible to totally prevent all ACL tears, but there are definitely things that you can do to make it better and make yourself less likely to do so.
Yeah, I think that's another one of the maybe common misconceptions, is that injuries have to happen right next to somebody else.
Oh yeah, it's not the case. A lot of injuries are non-contact. A lot of like lower extremity injuries, ankle sprains. They don't. There are so many different factors, like the field quality, the weather. There's just so many things that we can't control in sports. So really kind of being proactive and working on those prevention things before your season even starts. Taking the off season to spend time working on squats and deadlifts and working on ankle injury prevention, and just making sure that you're maintaining a strong body throughout the year. Very important.
Esther, do you have the next question?
So yeah, we were like in our document, there's a little bit about concussions in youth soccer. Could you talk a little bit about that, how prevalent they are? Is it more common in one gender over the other?
Yeah. So the common sports for sports concussions are generally football, soccer, hockey, those really high impact sports where you're doing a lot of colliding with other people. Women's soccer, as far as I can tell from some of the data that I've looked into, it seems like it's about the second most likely concussion risk under American football. So it's a really, really big problem, and it's a problem that can have consequences on the rest of your life. So it's not something to be taken lightly. I think the first step is recognition and education for young athletes, just to understand that it's something, you know, if you have concussion symptoms, your cognitive function for the rest of your life is not worth finishing the game. And I know that's not how a lot of people think. I mean, I definitely didn't think that way when I was 16, playing youth soccer, but it's something that people fortunately intervened and let me know that as a young athlete, just having concussions of my own. So that's important, is the education piece and really understanding the importance of good brain function, which seems really obvious, but it's not to everyone. Another piece that seems to be promising in the concussion literature is neck strengthening for concussion prevention. And there's some good neck strengthening programs out there where, you know, if you think about it, like having a strong neck that is ready to accept a force, especially when heading, is going to make the head move less. It's going to make the brain move less within the skull. So there's some good evidence that might be helpful. Also, we talked about that sleep piece, but the, general awareness on the field and making sure that you're mentally ready to step on the field and to make good decisions and you are prepared. When we get fatigued, we tend to make more mistakes on the field. And so just making sure that you're in good shape and able to play the entire duration of your match. Because that, the fatigue piece, getting tired and just being sloppy, we see a lot more fouls happening near the end of the match because people get sloppy. So it's so multifaceted. But yeah, it's unfortunate. It seems to happen more to young females. But you don't have to, be a victim of that. You can do things to try to prevent it.
Yeah. So I know there's a lot of education around preventing a concussion and recognizing the symptoms. If you're in a situation where someone is experiencing them, do you think that U.S. soccer or soccer in general needs to do more on educating how to head the ball? Because are there more concussions when the ball hits a different spot on your head, or is there one place? As far as ball placement resulting in concussion?
I mean, you can really get hit in any part of your head and get a concussion. You can even not hit your head and get a concussion. You can be like jolted to the ground and your head can move, but your head doesn't touch the ground. So I wouldn't say it's so much placement, but it definitely is a good thing to start early. I know the U.S. soccer starts around 10 to 12.
I think they can start heading the ball at 11.
11. Okay, so right in the middle there. Which I think is great. It's good to learn early. It wasn't something that I was ever taught really early, and I think I was afraid to head the ball. But I think if you start early and start with neck strengthening and good form, I think that can be really helpful. Of course, there's really no way to anticipate, if you're going up for a header and someone else clocks you on the head, there's no way to be ready for that. But I think there's a certain level of prevention that we can do. So yeah, I think U.S. soccer does a really good job with the education piece. I think they're doing it right. Um, I think it's a very important thing, big part of the game.
There's a massive push. What was it, like 5 years ago, something like that, to really educate players, and not just the coaches,
Mhm.
in what a concussion is and why it is and all the things surrounding it. And then they put in like you said, the limitations on the younger players, because a lot of younger players were getting concussed because of a lack of education. So I think there has been a really massive push.
Yeah, it's good to see.
Yeah. Do you have any like resources, things that you really like in terms of neck strengthening exercises?
I don't have anything like off the top of my head. I've definitely like read a couple research studies on it. I can take a look and send it to you. I know it's something that they're always looking into. I don't think there's anything like definitive, but I think that there's some promising research. Also, I don't have it now for you, but I can certainly take a look and send that your way.
Yeah, for sure. Thank you.
Yeah, you're welcome. You know, not totally familiar with all the research that's out there, so I'd like to look around a bit.
Mm-hmm. Yeah. Maybe some questions from the Instagram. We put out a little poll the other day.
Yeah.
And some people respond. What are some of the common causes of knee pain and ways to prevent or deal with it?
Ooh, knee pain's tough. That's probably my number one complaint with with youth athletes. I think it's generally caused by a combination of a couple different factors. It can be your anatomy, how you're built. Women tend to have wider Q angles, which is like the angle of the pull of the quad muscles on the knee. So that can play a big role. A lot of boys go through growth spurts and end up getting Osgood-Schlatter's. So that's something that has to do with their growth and their structure. Another thing is form and landing mechanics, like I talked about. Not just landing mechanics, but lifting mechanics. That plays a pretty big role. I'll see a lot of knee pain from people who are trying to do front squats with way too much weight and really poor form. And then I would say also overtraining or like taking the load into consideration. So, sometimes your body just plain may not be ready to do the amount of work you're doing. So that's another piece. I'd say like the structure, the form, and the load, those are really big things for youth athletes with knee pain. I can't overstate the amount of importance that there is in hip strength and like the glute muscle group strength. Just the general rotators of the hip. It's very important to strengthen those. Even for knee pain, for lower extremity injury prevention, the glutes are super important. And if you have weak glutes, it makes you more likely to have back pain, knee pain. So there's a lot of things that, just looking at the pelvic area and making sure that you're strong there, that's very important for knee pain prevention. There's a lot of good resources online, different home exercise programs. You can go on YouTube and find hip strengthening programs. If you're having knee pain, it's anterior knee pain, which means like the front of your knee. That's probably the biggest complaint that I see with youth athletes. And it's something that can so easily be solved. With a few tweaks to your training schedule and some strengthening and just changing mechanics. So many people suffer through knee pain needlessly. There's a lot of things you can do about it. So if you have knee pain, talk to somebody. Some physical therapy might be the trick. Changing how you're squatting in the weight room might help. So just ask for help.
I feel like that's a good motto for anything, really.
Just ask for help. You don't have to suffer.
Yeah.
And so it's easy to take care of. There are lots of people who want to help you.
Yeah, for sure. And what are some of the most common mistakes or misconceptions that you see in people's workouts, their mindset, things like that?
Yeah, I would say not, one of the biggest things, I know I talked about load, but just not evaluating like your needs. And like people, I see a lot of kids, like just to go back to that form with weightlifting, they're adding weight and adding weight. They think that they need to be, you know, adding more weight to be good at their sport. But if you're not taking into account your foundation and you're not doing the exercise well, you're putting yourself at higher risk. So like, especially with squats and deadlifts, I see so much low back pain with my kids that are trying to deadlift so much weight. And then I go in the weight room and I look at how they're, well, I'll even look at how they're squatting and deadlifting without any weight, and it's already bad. So I can't imagine how much worse they're making it adding 200 pounds. So just kind of going back to the basics. I think that's really important for your workouts. If you're having pain from anything you're doing, make sure that you roll it back, get some help and roll it back to the basics. Yeah. And then to go on top of that weightlifting thing, just having too much weight and not reevaluating what your needs are. I think it's important to, if you're doing a lot of weightlifting, to evaluate your 1 rep max and to make sure that you are lifting an appropriate amount of weight for your body and your muscle strength. So I think, you know, a lot of people want to look awesome and bench press so much weight and deadlift so much weight, but it's really important for you to evaluate if that's appropriate for your body. So just kind of being realistic and asking for help again. There we go.
Yeah, help, and the fundamentals are important.
Yeah.
If you can't, like you said, if you can't lift 10 pounds appropriately, you won't be able to lift 100 pounds and really grow in between. And I think that a lot of youth athletes miss that because they get taken into the mental of the process. Like, I'm going to be so much better if I can lift 500 pounds. And they forget that middle step of, you're not ready to do this yet. And
Right.
then they tend to get injured more often.
Yep. Yep. Definitely a good thing to listen to your body and just make sure that you're not doing too much. Sometimes you just have to let yourself be a beginner again at something, even no matter what it is, how long you've been doing it. If you feel like you're hurting yourself or it's not moving in the right direction for you, you need to reevaluate and just allow yourself to take a step back and remember why you're doing it and just go from there.
Great point. That's fantastic. So I know that you have a lot of experience with ankle injuries.
You see my face light up with the word ankle.
That's the only injury that I've ever experienced as an athlete in my career as well. But how did your experience with ankle injuries lead you to where you are today?
Yeah, I mean, that was the big thing that I struggled with starting from age like 12 or 13.
Mm-hmm.
It starts so young, and if you don't take the steps to remedy it when you're young, you're going to end up with something we call chronic ankle instability, and that can just really be devastating for your lower extremity if it's not taken care of. So yes, I very much struggled with ankle problems my entire time as a youth soccer athlete into high school. So that definitely exposed me to my athletic trainer at my high school and made me realize that there's this area where you can hang out in sports and help people and do exercises. And I really enjoy the study of anatomy. So that it just seemed like a really good fit for me at the time. Yeah, I think that definitely the ankle instability isn't fun, but I'm glad it led me down this path of sports medicine. I have to find the bright side, right?
Yeah. I feel like a lot of athletes, once they get injured, they do follow that kind of progression because they've learned so much about their body through the process of recovery and through the process of surgeries and being around the doctors, being around the trainers, that they do start to kind of just fall into that.
Yeah, I think it's really empowering to learn about your body and the things it can do. I'm, probably a little bit more passionate about learning about the body than most, youth soccer athletes, but I think it's neat to just find out more things about it, and it's empowering and helps your game for you to use the resources around you. So I think that's probably what launched me in this direction, is just the exposure at a young age. And I, certainly dealt with a lot of the like mental piece. I'm just being really frustrated that I can't play and I'm not playing at my best. And it was cool to learn that I could do something about my health,
Yeah.
and improve my life in that aspect. Yeah.
What was the piece of advice or the thing that helped you mentally through your injury the most?
Maybe I would say like leaning on the people around you.
Mm-hmm.
I mean, when you have an injury, it can be a really isolating thing. Your role in your team and your family and its school changes depending on the severity of it. And if you're going to PT all the time, it's hard to be involved in the team, especially after like a surgery and a major injury. I think it's really important to continue to play a role and really try to stay involved with your teammates and the people who make you feel good and you enjoy being around. I think that being involved in the team after an injury is a very important part of recovery. And is one of the things that really got me through some tough injuries as a youth athlete. I think you guys would probably agree with that being around your people is super healthy for you after an injury.
Yeah, something that we've done in the past for some of our injured athletes is during team training, they can come and, either observe or take notes, or depending on the injury, they can lay out the field. And then we can count those as community service hours for their high schools. So kind of like bribing them in that sense, like, you're injured, it's going to be a while, but please, have that in place with your community.
Or being a player coach, or throwing balls in for drills, or just finding a way to stay involved, even if it's still just going to team dinners once a week. I think it's definitely a good thing to stay involved, and that's just such a big part of our identity as athletes, I think, is being part of the team and having utility for the team. And I think when that gets taken away from you with an injury, it can be a really make or break thing for you. I've seen a lot of young athletes really go into depression after a bad injury. And I think that the ones that stay involved with the team and find meaning in their new situation are the ones who do better. And your mental health has a really big impact on your injury resolution. So definitely important.
Yeah, for sure. And my next question is back to the ankle part. What what exercises would you recommend for strengthening your ankles?
Okay, yeah, that's a good one. I always tell my kids at school that in my opinion, from what I've looked into and some research, is balance is probably the biggest bang for your buck. Even it's as simple as standing on one leg while you're brushing your teeth for 30 seconds on each leg, or however long it is you brush your teeth. Stand on that ankle. When you feel like that's not very difficult anymore, then close your eyes. It's amazing how much harder that single leg balance is when your eyes are closed. We have so much visual input for balance, and so when you take that away, you're really working other pathways. So I think balance is very important. Different range of motion exercises, but I think doing balance and change of direction and making sure you're stable when you're cutting and pivoting, those are important things for you. Just doing it in a more functional environment. You can do all the band 4-way range of motion exercises. You can do that forever, but if you're not loading your ankle and like stabilizing the ankle while you're doing that change of direction, I mean, that's the functional thing that you're doing on the pitch. So I think just changing it up and keeping it fresh with the ankle stuff. But yeah, balance. I would say if you take one thing away from this, after this is over and you're done watching, try to stand on your right ankle for 30 seconds and close your eyes and see how many times you have to touch your other foot to the ground, and then do it on the other side. Just doing a really basic balance task. If you choose to do anything, that's pretty easy. You don't need much equipment. You can stand on a pillow to make it more difficult. You can have somebody next to you, like pushing you. That kind of mimics, contact in a soccer match. Just switching it up and making sure it's not boring.
Yeah.
You can always find ways to make rehab more exciting.
Yeah. I know when I was coming back from my ankle injury, I used the Bosu ball a lot.
Yeah.
So I would just like stand there on the Bosu and play FIFA for a whole time.
Yeah. I'll have people take foam rollers and like joust with them, or like have a sword fight with foam rollers while they're standing on Bosu balls.
That's awesome.
You got to keep the people entertained. For sure.
That's awesome. Aishu, what's next? We've been talking about ankles.
Well, yeah, I haven't touched a soccer ball or a soccer pitch since like sophomore year of high school, which is bad. I'm outing myself. But I was thinking about this question, like, if you had any advice for someone who wanted to like get back out there after, how long has it been? 4 years of not playing soccer at all, like what advice would you give them in terms of injury prevention, especially because I haven't really been an athlete for a while. So
I would take it slow. I wouldn't start going out into like a really, really competitive league. Maybe just like keep it basic, keep it fun. That enjoyment part of it is probably the key. Because if you're not enjoying it and it's way too challenging and you're getting hurt, then what fun is that? I would say just taking preventative measures, like maybe getting some ankle braces. Those can be really helpful. And just overall improving cardiovascular fitness. I would say it's a good idea to like kind of start that before you really get back on the field, just to make sure that you aren't putting yourself at risk for injuries just because you're out of shape or whatever. Start slow, enjoy it. There's no need to hurt yourself. So
yeah, maybe I'll go outside then.
And work on core strength. I know one of the questions that you had in your document was some examples of some things to do at home for athletes. And one of my favorite exercises that I give all of my kids at the high school are planks, which sounds really boring, like, oh, you're just sitting there. They are tough, even if you're just on your elbows, but there are so many things that you can do to actually help make planks more interesting. So you can do like limb movements. You can kick your legs back while you're doing a plank. So you're on one leg and you're kicking the other one up, then the other side. You can be across from a pal and high five each other while you're doing a plank. There's a lot of ways to make core strengthening more exciting. But yeah, nothing like a good plank. Some good core bracing. It's really important.
Yeah.
Okay. Go ahead.
Oh, okay. I was just gonna say we could open it up to the audience for Q&A if they have any questions. Matthew, go ahead while we're waiting.
Yeah, Q&A. Put some stuff in there. I was just gonna say that core strength is important for mobility as well. Because if you don't have a solid core strength, then kind of your cuts and your changes of direction, overall mobility aren't going to be as crisp as well.
Yeah, definitely. And you just put if you don't have a solid core and you're just kind of like letting your body flop all over the place, you're going to have back pain, you're going to have knee pain. So it's an important place to start. It certainly moves beyond planks, but I think if you can't hold a plank for a minute and you consider yourself an elite athlete, I think you need to reconsider that and and take your time to work on your core strength.
No questions rolling in. I know a couple of the audience members, as you age, going from high school to college to post-college to, maybe becoming sort of a geriatric athlete, how do you care for yourself through that transition?
It's about managing expectations and being realistic. Mm-hmm. The soft tissue, connective tissue in your body just decreases in strength and pliability as you get older. So that's why we see a lot of Achilles tears, quad tendon tears, that kind of stuff in like that middle age range. So just, understanding that your body is changing and it sucks that you can't do what you used to be able to do. But just finding a new normal for you and your changing body. We change so much throughout the lifespan. So I think just understanding that things will change and that's inevitable and it's okay.
Yeah. So instead of being a pacey winger when you're 18, you might be a really solid positioned center back by the time you're 40.
Maybe.
Oh, we have a question. What would you say about working out every single day? Should you take like breaks between days?
Yeah, I think it's important to listen to your body. If you're having pain after several days working out, take some time off. I mean, our bodies do need time to recover. It largely depends on the load that you're placing on your body. But yeah, I definitely think a day of rest is important. I think that rest day will look different for everybody. So if you're like used to just really killing it in the gym all week, and a rest day looks like leisurely riding a bike, that's good for a rest day. We can do active rest. It doesn't have to be lay on the couch all day. You can find different ways to rest, but still move your body. So yeah, I think that there is definitely, a need for rest, and there's a huge need for you just to listen to your body.
Mm-hmm. And then the next question from Alex. Apologies if you missed this, but when would you start icing?
I guess I'm not sure if he means like post-injury or like just preventative icing. Ice is not going to heal injuries faster. We use ice as a tool for pain control. And I think that if you feel like, oh, I see that he said preventative. So, there's definitely some mixed messages about using ice preventatively. There's some research that says it might help for the like 10 minutes after, like if you take an ice bath 10 minutes after a hard workout, you may have decreased soreness. I think it's just kind of what works for you. I don't know that there is like a one size fits all. The research around icing is kind of mixed. I think if you feel like it's helping up your game, then definitely keep doing it. That it can make you feel like you've done something good for yourself, and that can kind of improve your recovery. I don't think it's as important as rehydrating and replenishing nutrients. So I will say that. But I think if it's a piece of the puzzle that you really found has helped you, then continue to do it. There's no harm.
Yeah. I don't think that it would be used as a replacement for stretching though. But so I
no.
guess as a cool down stretch, you're like, oh, I'm going to wrap some ice on my legs and call it a day. Not quite that cool.
Oh, don't do that. That's dumb. You need to stretch and foam roll and take care of your soft tissues. And then, if the icing afterwards helps you recover, then yeah.
Another question from Alex. How much water should you drink every day?
Why did I know this one was going to come up? Um, there are definitely different recommendations. I mean, there are good resources online, like Gatorade has some good resources on, fluid replacement. I think it depends a lot on what your activity level is. So if you're not, doing a lot of cardio and sweating a ton, there's less of a need to replenish than if you're really spending a lot of time out in the sun, exercising. It's all about the amount that you're exercising. I would definitely utilize the internet on this one though, and kind of see, what the recommendations are for how much you're sweating, what the temperature is outside. There's definitely good recommendations out there. But there's not like one set amount that every human needs. I think our needs are really different. That said, it is really important to have water and over like sugary stuff. And just keeping yourself well hydrated is going to help healing. So, but I don't have any sort of like set amount that you should be drinking.
Yeah. The ice thing kind of reminded me of something that I wanted to ask.
Yeah, go ahead.
What are some common myths that you hear about injury prevention, like the ice thing, that you would say are not all the way true?
Myths around injury prevention. Ice is a big one. Like you have to go ice, you have to ice bath. I would say like doing a lot of static stretching before exercising. That's another big one that is not all that helpful. I think to clarify that, like dynamic stretching, so doing more like functional movements like lunges and heel pulls and butt kicks and high knees, like that kind of dynamic movement, that's really the key in warming up. The static hold stretching, we're kind of past that in the literature. Like we know that doesn't really do all that much as far as flexibility and injury prevention. That said, if you feel like static stretching is helping you, it's another one of those things kind of like ice. If it makes you feel prepared for your game, then you can do it. But it definitely shouldn't be done by itself. You need to get dynamic movements in there. I know there are other ones, but I can't think of them right now. But I would say like those things like ice, like you must do ice after. I don't think that's true. I mean, if you feel like it's helping, then use it. But it's not like everyone must ice kind of thing.
That's a good question. So I think we're going to
that's tough.
To wrap it up. A lot of really, really insightful questions and answers all across the board, and we really appreciate you coming on and helping us out with this and getting a lot of this really impactful information across to the athletes. Thanks. What's the word I'm looking for?
Oh, there's another question.
Eddie's got another question.
Soreness. He says, how about soreness? Should I immediately foam roll? I think immediately after is probably the best time. There's like some good research that indicates it might help with soreness later on. Your muscles are the most filled with blood and definitely are the most moldable during that time. So yeah, immediately after I think is a very good time for foam rolling. And that might help you with some soreness. I love foam rolling. I mean, I hate it when I'm doing it, but I like it afterwards.
Yeah, I think a lot of young athletes.
I think we all feel that way probably.
Yeah, they don't like that pain that comes from releasing some of those knots and the lactic acid that's built up. But
you can really find some relief afterwards.
Yeah. Every time that athletes have been crying and then they stand up and like, oh wow, I can move. I didn't feel like this before. It's magical. And all it took was one foam rolling session.
You know why that is your body actually creates its own brand of like pain medicine. So when it's having discomfort, it's actually like you know, part of the reason is because you're creating that from your brain. You're creating that like endogenous opiates. It's amazing. The body is so cool.
That's awesome. I didn't
Yeah.
know. It's definitely a good feeling though.
It is.
Fantastic. Well, let's wrap this one up. Another episode in the books. Thank you for coming on. Thank you everybody else for watching us as we conclude our 7th episode. Really fantastic stuff, really pertinent information for our group of athletes and athletes everywhere. So thank you for being a really fantastic guest and resource for our players.
Yeah, you're welcome. It's really fun to talk about sports. It's been a while.
Yeah.
I'm tired of hearing about COVID. I just want to go back to soccer.
Yeah.
June 17th.
Yes, almost there.
Yeah.
Thanks, guys. I really appreciate coming on. It was good. It was a good time.
Yeah, thanks for helping out.
Yeah, happy to.
Actually, do you have our last slide?
Yes, I do.
But hey, thank you to our sponsors. Shout out to Leveling the Playing Field, helping us out with equipment for all of our players. One Step Beyond Fitness, helping with our fitness sessions, and B&G screen printing and embroidery, sponsoring our kits and all of our team apparel. Thank you, everybody. And we'll see you next time.
See you guys.
Bye.
Bye.
Bye.